We now turn our attention to hearing loss. There are two types of hearing loss. You can have a conductive hearing loss. That's due to a problem in the outer or middle ear. Remember, the outer or middle ear conduct sound to the inner ear. So if we have a problem in those areas, sound waves can't reach the inner ear, and thus you have conductive hearing loss. So that's a problem, like we said, over up here. That's conductive. Next is sensory neural hearing loss. That's a problem in either the inner ear or the auditory nerve. And that's because the neurons can't transmit to the brain the sound because you have a problem in either of those locations. So now we're going to look at how to differentiate the two. And we have two tests that we're going to use to differentiate it. The first test is the Rin test. If you ever learned this, try to recall how we do this. What is the first step? First step is to place the tuning fork on the mastoid, which is the bone right behind your ear. And what that does is if you have the tuning fork on the bone behind your ear, you're going to transmit that sound. You're going to skip the outer ear and transmit that sound through the bone of the skull. It's going to transmit it to the inner ear. Once that sound is no longer heard, you take that tuning fork and you place it near the auditory canal. So step one is bone. Then you go to the auditory canal. Then that's air. And then the patient's going to tell you when they can no longer hear the fork. So this is a normal test when air conduction is better than bone. And what that means is that they are still able to hear the tuning fork once it's been removed from the bone and it's put near the ear. So remember, you take it off the bone once that patient says they no longer hear the sound. So they stop hearing the sound, you take it off the bone, you put it near the ear, and they hear it again. That's a normal test. And this is because the outer ear, which is this canal here, normally conducts sound better than the bone will if nothing is obstructing that outer ear. Okay, next is the Weber test. What do you do here? This picture tells you all you have to do. You just put that tuning fork in the middle of the forehead and you ask the patient which ear they hear the sound louder. And if it's normal, if they have nothing wrong with their ears, then a normal test will be when the sound is heard equally in both ears. So we have to use both of these tests to be able to determine whether you have conductive or sensorineural hearing loss. So let's take a look at conductive hearing loss. Let's see if the Rin test will be abnormal or normal. We said that the Rin test would be normal if air conduction is better than bone conduction, and that's given if nothing is wrong with this outer ear. Well, what's the problem with conductive hearing loss? We just said conductive hearing loss is when you do have a problem in that outer ear that's preventing conduction of that sound to the inner ear. So Rin test will actually be abnormal. That is, they will hear sound better with the bone rather than with the air because something's obstructing that external canal. Now let's look at the Weber test. Will this be normal? It will not be normal. And which ear will hear it better? The affected ear? Let's say this ear is messed up, okay? This ear has conductive hearing loss. Will sound go to the normal ear or to the affected ear? And this is a very tricky one that takes some time to think about. But the answer is that it lateralizes to the affected ear. And you're thinking that the affected ear has hearing loss. Why would you hear it better? Why would you hear the tuning fork better on the affected ear? That doesn't make sense. Well, remember the problem again in the conductive hearing loss is problem on the outside. So outside sound is not going to go. There's not much outside sound. So we have a lot of outside sound to this one because it's normal. This one does not have much outside sound because that has conductive hearing loss. But this tuning fork on the head is going to transmit, it's going to skip the outside of the ear. And it's going to transmit directly to the inner ear. So it's going to go straight to the inner ear. This side is going to go straight to the inner ear. So you have extra disturbances here. There's more other noise that's going to reduce the amount of sound you can hear from this tuning fork. This side doesn't hear much noise. So this one's going to sound, they're going to perceive this sound much more louder on the affected side. So in the Weber test, Weber lateralizes to which side? It lateralizes to the affected ear. I hope you can understand that. Again, it's told all because there's less ambient sound going to that affected ear because you have conductive hearing loss. And so that tuning fork, which is going to go straight to the inner ear, is going to sound louder on the affected ear. Okay, next is sensory neural hearing loss. What will happen to the Rin test? Remember, Rin test tells you if there's something wrong with the outer ear. Is there anything wrong with the outer ear? There's nothing wrong with the outer ear, so Rin test will be normal. Okay, that means that air will conduct better than bone. So after you take that tuning fork off the bone and put it near the ear, they're going to hear that sound again. How about the Weber test? Which ear will the sound lateralize to? Now this one, we're going straight to the inner ear again. Let's erase all this. When we take our sound straight to the inner ear, this inner ear is not working. This is the affected ear, okay? Remember, this is the affecting ear. This inner ear is not working. This inner ear is working and sends sound to the brain. So your sound from the tuning fork is going to lateralize to the unaffected ear. Alright, so that's it for our testing of hearing loss. So remember that you need to use both of these tests to identify. You need to see this pattern. You need to see both of these together to be able to say it's conductive hearing loss. You need to see both of these together to say it's sensorial hearing loss. Because if you don't know which one's affected. So let's say Weber lateralizes to one ear, but it could lateralize to the affected ear or the unaffected ear, and both of those have pathology. So you need to do both to be able to see. Now let's talk about causes of hearing loss. There's going to be three we're going to talk about. The first one is noise induced. And this is because of damage to the hair cells in the organ of Coti, in the cochlea. Remember, those hair cells are the ones that vibrate and then will transmit signal to the nerve, to the nerve that's responsible for hearing. And what you're going to lose first is you're going to lose high frequency hearing first. And this is sensory neural. Now, another thing that can happen is you can have a very sudden loud noise, and this can cause hearing loss because of rupture of the tympanic membrane. Remember that tympanic membrane, remember what that was? That was the intersection of the outer and the middle ear. So is this going to be a sensory neural or conductive hearing loss? Well, this is in the middle and outer ear, so it's a conductive hearing loss. So sound can't transmit to the middle ear because your tympanic membrane is necessary to vibrate and cause the vibration of the middle ear bones. So you can have noise-induced hearing loss that is sensory neural, or it can be conductive. And sensory neural, again, is damage to the hair cells, and those are in the inner ear. Next is presbycusis. This is an age-related progressive hearing loss, and it's just progressive damage to the organs of Coti. Again, you're just getting older, you just get damage, it degenerates in the organ of Coti. And again, you lose high frequency hearing is lost first. So is this sensory neural or conductive? Well, you have to think about the location. It's in the inner ear, so it's sensory neural. Okay. Finally, we have a cholesteatoma. This is an overgrowth of squamous epithelium from the tympanic membrane. This is squamous epithelium overgrowth. As you can see in this picture, this nasty little stuff. It's just squamous epithelium that's growing from the tympanic membrane in the middle ear, and so it's blocking sound. So what kind of hearing loss is this? This is a conductive hearing loss because it's in the middle ear. Kind of like the middle and the inner outer ear. One thing that's tested is sometimes they'll say, "Oh, what is it made of?" And one of the answer choices might be cholesterol, and you might be very sorely tempted because you're going to see cholest. You'll be like, "Oh, this must be cholesterol. It must be made of overgrowth of cholesterol," and it's not. It's a misnomer. It's not an overgrowth of cholesterol. It is an overgrowth of squamous epithelium. So that's it for our causes of hearing loss. So as you can see, you can understand all of these types of, you can understand whether it's conductive or sensorineural because you're going to know the pathologies and how each of these come to be. So that's it for hearing loss.